Welcome back and thanks for staying with us. Nursing Union Denosa has criticized government's economic stimulus plan, saying it disregards health professionals. Earlier this week, President Cyril Ramaphosa announced a relief package that will see social grant recipients and the unemployed receive monthly stipends for the next 6 months. The plan also includes tax relief for businesses and measures to protect and create jobs. Denosa President Hlungwani says Ramaphosa seems to have disregarded the fact that tens of thousands of civil servants won't be getting their annual wage increase this year. For an update, we cross via Skype to Denosa Secretary General Cassim Lekhoathi. Cassim, a very good morning and thanks for talking to us this morning. What were you hoping the President would have announced to assist nurses?
Good morning to you and to your viewers. Yeah, indeed, with regards to the stimulus package which was announced by the President, it has really disappointed us as Denosa. We're hoping that, among other things, the President will be sensitive to look at the plight of the frontline workers, the nurses in particular, to consider giving them at least what we'll call a risk allowance. And short of that is to waive the issue of a tax break. So that, and that model, we've said it, Ghana has done it as a country, and we don't believe, therefore, South Africa could have done it also.
Without giving detail, the President announced the extraordinary health budget, which he said the finance minister will be outlining details of at an appointed time. Do you not think you're perhaps putting the cart ahead of the horses?
If we've listened attentively to what the President had been saying, that the amount for the 2 billion rand, it will talk about the issue of procuring PPEs and or for staffing. And here we are talking about over and above that, which we welcome that, the staffing part, and I hope it will be done, and the procurement of the PPE. But here we are talking about as an incentive to motivate the healthcare workers to push more and harder in their fight against the coronavirus and so on.
So how are you engaging government in this regard?
We have made a call to the Ministry of Health that we need to engage them, and we believe, therefore, it's never too late to still engage. And if that can be done before the President can make his announcement tonight, he can make that inclusion in his statement and acknowledging these people who are sacrificing their lives. Going forward, I want to believe that will be something worthwhile. And I can just say nurses throughout the country are very, very upset, and they feel that they are owned by themselves. They are not being recognized. And we hope to secure a meeting as a matter of utmost urgency. The call has been made out yesterday. We are waiting to meet the ministry, hopefully by today, before the announcement is made and so on.
So if I get you right, you're saying it's all good and well to talk about personal protective equipment and facilities and making sure that the country is ready, but you also need to acknowledge the human capital in the fight against COVID-19.
Yeah, if you look at the rollout of this economic stimulus which has been rolled, it's addressing more issues on business, nothing about the healthcare workers, nothing about the nurses. Yes, the issue of procuring a PPE, it's a non-negotiable thing, and that's one we put on the table, that in the absence of it, we will not advise our members to compromise their lives. And we are further saying, if the public can also remember, when we started off with this lockdown, there was an undertaking that transport will be provided for healthcare workers. And up to today, there's no transport arranged for essential workers. These essential workers have to go out of their own to pay double now towards transport, because they have to move from one place to the other to reconnect, whereas in the past they would just take from A to B. And we must also appreciate the fact that not all nurses, if not, don't have their own transport to commute to work. That has created a strain. All what we're saying is to control or to minimize the strain on the healthcare workers and to encourage them to move an extra mile. These measures have to be taken into consideration. And what adds injury to all this is, as from the 1st of April, the salaries were supposed to be, they were supposed to get a salary increase, which was agreed 2 years ago. And the government have just decided to say, no, they don't have the money. That alone has added to the burden, and it is frustrating our nurses. As I'm talking to you now, you're going to get reports that a lot of nurses are not reporting for work. Not that they are on strike. They are frustrated, and they are depressed, and the healthcare system cannot afford at this stage to be without nurses. And we make that clarion call for those who are advising the president, as if they can make him listen and send him this chip. We are pleading with your good president. I know you are a progressive leader. Do the right thing. And we are calling on the Minister of Health, Comrade Zweli Mkhize, to up the game and not drop the ball. We are here. We are prepared to engage you. We believe, therefore, it is not too late. What was announced the day before yesterday is not cast in stone. All changes can still be made, and a consideration to the nurses in particular can and must be done as a matter of utmost urgency before the president announced tonight.
Very well put. And Cassim, we're talking about working conditions and administration, but just before we end our conversation, let's just talk about the humanitarian side. How are the nurses? They've had a lot to deal with since the outbreak from an emotional and mental health point of view.
Thanks for raising that. Up to today, we are still getting reports of institutions who do not have the PPE. And our nurses have to be exposed to this condition. As late as last week in eThekwini, when they came with these measures to close down eThekwini, one of the nurses in the public hospital was diagnosed positive, and they had to send an ambulance to her house to go and fetch her in front of the community. As we are talking now, we are even told the community don't want that family around there. And we have advised the management not to make that call because it's pre-exposing the nurse. And the nurse was making a passionate plea. I can bring myself, if at all it means itself, forced quarantine. To bring the ambulance and the way the guys of the ambulance were dressed, it will scare any other person, including yourself, if you see that your neighbor is coming to be fetched in the manner he was going to be fetched. And she was threatened that if you don't come, we'll bring the soldiers to come and take you out of your house.
Thanks for talking.
That we regard it was very insensitive.
Due to time constraints, we have to end it there, but thank you so much for talking to us. Cassim Lekhoathi is the Secretary General of Denosa.